And if you want to interrupt and ask questions as I go, then please feel free. So I am here as a volunteer with Menopause and Cancer. My name's Anna Goldsmith. So I just want to share with you information about the organisation, what we offer, and how you can use this and share it amongst Carly, your patients, and if you've got other community members to just share. So I'm a registered nurse. I work within menopause now. I've got my own business, support business in Hampshire, and I am a breast cancer survivor. I'll tell you more about that in a minute. So Menopause and Cancer, the charity, this is Danny here in the middle, is a not-for-profit organisation that was founded by Danny Binnington in 2022 after her own breast cancer diagnosis. I think hers was about 12 years ago, and she had ended up finding, so that was when she was 33, and when she was 39, she had her ovaries out and double mastectomy because she found out she was a BRCA carrier. And there just was no support for her going through her surgical menopause. So she started up the charity because she had a really hard time, and she just thought there's got to be more support for women who are either going through menopause because of surgery or because of a medical onset menopause, which I'll talk about later. And the vision of the organisation is to create a space where anyone experienced treatment-induced menopause or menopause after cancer can find support, information, education, and most importantly, a community. And it's a really supportive, lovely community. We do all sorts of fun things. It's a club no one wants to be part of, but we try to make the most of it. So it's our mission to bring together a community of experts with our community of people to help them have a better informed and more empowered menopause experience. So today, just hopefully it will be informative, jam-packed with sound advice, evidence-based facts, tools to put into practice, a greater understanding of menopause and cancer, to help you hopefully find your next step if you are struggling with menopause symptoms, and also to feel less alone, because this is something that affects many women. So just before I share more, I thought it would be good to remind everyone of the definitions of menopause and perimenopause. So menopause is when a person with periods has not had a period for 12 months. So it's literally one day, and the 12 months previously you've not had a period. The average age of menopause in this country is 51, but it usually affects women, can happen between the ages of 45 to 55, but it can happen earlier. If it happens earlier, it's premature menopause, and if it happens below 45, it's premature, and if it happens below 40, it's premature ovarian insufficiency, POI. And then perimenopause is the lead up to menopause and can last over a decade. And with a natural menopause, and when women go through perimenopause, it can be a real roller coaster of a time. And this can be the time when symptoms can be very difficult to deal with, and you don't know what on earth is going on. And symptoms can vary from person to person. Everyone is different. The first line treatment for natural menopause is HRT, and we'll go on and talk about treatment options, etc., in the next few slides. So the menopause conversation has really grown, I would say, over the last 5 to 10 years. There's been a lot more in the press around this and a lot of well-known people raising awareness. We're ever so grateful to them for raising this important topic, and everyone is talking about it, but group, if you're a woman who has been put into into menopause after a cancer diagnosis, it can be a difficult experience, and the treatment can be more complex than it is just for a woman going through a natural menopause. Now, with your particular diagnosis and type of cancer, you may be able to take HRT. Not all women who have had a cancer diagnosis can't take HRT. So it's mainly the hormone-driven cancers. So if you are struggling and you feel like that's something that you would like to ask about, then ask your team. That's not something that I will go into individual details with now, because obviously I don't know your individual circumstances. So why is menopause after cancer different? It can be triggered by your cancer treatment. So things like chemotherapy, surgery to remove ovaries, radiotherapy to the pelvis, endocrine therapies such as tamoxifen and aromatase inhibitors. And it can happen after any type of cancer, and it can happen at any age. When women are on the endocrine treatments, it basically shuts down or blocks the production of estrogen. And radiotherapy to the pelvis can damage the ovaries. So there's lots of reasons why it can happen. You can have a more abrupt onset, especially obviously with surgery, that you can have a real crash menopause, potentially more severe symptoms. You might have a lack of preparation, more complex to treat, possibly limited options, potential negative impact on long-term health, such as bone health and heart health. And often when the cancer treatment ends, the menopause symptoms go on. So for some women, they may be put into a temporary menopause while they're having their treatment. And then when their treatment is finished, they may get their periods back. If you are under 40, then you're more likely to get your periods back. The older you are, the less likely you are to regain your ovarian function. So it's a widely unspoken outcome of cancer treatment. It's rarely discussed, and it leaves many patients to undergo treatment without knowing if it will induce their menopause. And people can just feel isolated, not knowing where to go for help, and confused about what the long-term effect of the cancer treatment will be on them. So these are some of the comments that we hear every day at Menopause and Cancer. I wasn't offered any help with my menopause symptoms. I feel like I don't have any options. Is HRT an option for me? What are the alternatives to HRT? I just want to feel like me again. How do I manage cold turkey menopause? I feel lost. I'm worried about my bone health. I'm fed up of everyone talking about how great HRT is and I can't take it. We hear that a lot. We just cannot be part of the normal menopause conversation. My cancer team was amazing, but I had zero menopause support. So as you can imagine, this can be quite difficult. So after cancer treatment has finished, you may look like you're getting back to normal, socializing, etc., with your friends and family. However, you may still feel quite alone dealing with symptoms of menopause that you don't know how to treat. And they can go on for a long time after active cancer treatment stops or whilst you're on the continuous medication. So, menopause after cancer is the long-term unspoken side effect of cancer treatment that nobody is talking about. I'll now introduce you to Helen, who's going to tell us her story.
It was a huge shock to be diagnosed with cancer, and the treatment was brutal. And when you think of cancer, it's probably the most horrific thing you can think of. However, I can genuinely say that the experience of menopause for me is worse than my cancer or my treatment. Menopause was something which came completely unannounced. My surgical team told me that my periods might stop. That was the extent of anybody mentioning anything to do with what I now know is menopause. I was kept in the dark. I was treated like a child for that part of things. In other parts of my journey, my treatment, I was given lots of choices, lots of patient-centric care, which was really amazing. But menopause was this black hole. Nobody spoke about it. It was not even mentioned to me that menopause would happen. It's time to talk about menopause and cancer because we're here. There's thousands of us who have survived. And thank goodness that those numbers are going up all the time. Survivorship is increasing. We need to now. We're not just statistics. We are people with hopefully long, healthy lives ahead of us. And how our menopause is supported can make an enormous, immeasurable difference in that quality of life after cancer.
Okay, so you're not alone. This is a global problem and it's a growing problem. The World Health Organization has said by 2050, there'll be 16.3 million women globally diagnosed with cancer each year. And we know that survival rates are increasing, which is fantastic, thanks to better treatments and research. So survivorship really needs to be looked at more now. Almost half of oncology nurses do not currently provide menopause advice. In the UK currently, around 186,000 women per year are diagnosed with cancer. And there's a big proportion who will experience menopause as a result of their treatment. And they might need specialist treatment. Waiting lists to see a specialist on the NHS is up to 18 months, a menopause specialist. So it can be difficult to get help. And I know my breast team, they are really proactive and, you know, would love to have a menopause clinic within their clinics, but there's just no funding. So it can be quite difficult to get the help that you need at times. We do a lot of research in our community, and this is some of the things that people have said. 95% had no idea of the significant impact that menopause would have on them. 77% didn't receive adequate help in managing their menopausal symptoms, and 92% reported feeling isolated in their experiences. And we hear this a lot. Our volunteer group has grown a lot this year. There's about 40 of us around the UK now, and we do things like walk and talks, and we do other events, which I'll talk about. But women just say it's just so nice to be able to talk to other women and not feel so alone. So, you know, that's why it's great doing events like this and being able to share our experiences. So this is my story. So as I said, I was diagnosed with breast cancer 2 years ago. I had a lumpectomy and radiotherapy. I have also had risk-reducing surgery I found out that I had a genetic mutation called PALB2, which is similar to BRCA. So I had a very high risk of my cancer reoccurring. I also had a high risk for ovarian cancer. So I had my ovaries out last year, and I had a bilateral mastectomy done and a DIEP reconstruction in March of this year. And I know I'm an older woman. I'm 58. I was 56 when I was diagnosed. But I found it astonishing that when I had my ovaries out, not one healthcare professional talked to me about menopause. I was handing out menopause and cancer leaflets when I was in there and just saying, please talk to your ladies about this. I had excellent support via my consultant breast surgeon and breast team who listened to me talk through my thinking and my decisions. I was an active participant in decisions regarding what type of surgery I had and the subsequent endocrine therapy I had to take. There was no discussion of my menopause. I was told I would need to stop HRT. This really worried me because I'd been on an HRT for 11 years. I went through menopause at 45 and I loved my HRT. So I was really worried about that. But there was no discussion of management of potential menopause symptoms. They just said, you will need to stop your HRT. I was lucky because obviously the job that I do, I had the understanding, but I also knew, what the symptoms were and potentially how bad I could feel. So it was a bit of a double-edged sword. I felt I was living in an experiment. Stop HRT, see what happens. Start endocrine therapy, see what happens. There was no prior discussion about what could happen and what to look out for. I know it's difficult because each woman has such an individual experience that it's difficult to predict what's going to happen. And it's the same with is individual. So I do appreciate that it is difficult. So this is a symptom checklist that you can find on the Menopause and Cancer website. And you may be aware that there are many physical and also psychological symptoms of menopause, which I'll go into more detail in a minute. But it can be really helpful to look at a symptom checker and make a note of your symptoms. Are they due to menopause or perhaps your treatment? It can help to unpick what's going on. And when you go to your doctor and you've made a note of what your symptoms, it can help them help you. So you may be experiencing some or many of these symptoms. So on the 18th of September, we launched the World Menopause and Cancer Awareness Day. So that will really be shining a spotlight on menopause and cancer now. So that was fantastic. And hopefully every year we will be getting that conversation going. So now I'm just going to go through examples of some of the symptoms that can occur. There's a few slides. I'm not going to go into great detail about them. If you've got any questions, then please jump in and ask me. Things like difficulty sleeping, loss of libido, night sweats, hot flushes. We have estrogen receptors all over our body, so we can get psychological and physical symptoms. And when we have a lack of estrogen going into those receptors, that's why we get the symptoms that we do. And like I said before, it will be very individual. Some women will just get more psychological symptoms and others will get more physical symptoms. And it can change. For example, for me in my natural menopause, I didn't really get hot flushes, and I get lots of hot flushes now. So it's like, great. It's just the gift that keeps on giving. So yeah, it can change. Dry, itchy skin, dry eyes or ears and nails, thinning hair, oral health changes, headaches, heart palpitations, migraines, tinnitus, which is ringing in the ears, feeling dizzy, changes to your periods. So if you're having a natural menopause, then you will be getting changes to your periods. If you are going into menopause because of cancer treatment, you'll probably have quite abrupt changes to your periods. Vaginal symptoms, so things like vaginal dryness, the pH in the vagina can change. You may get sort of itchiness, have painful sex, you can get sort of splitting skin and a bit of bleeding. It's really important if you have any of those symptoms to go and speak to your doctor about that, because they will just slowly get worse and they are very easily treatable. Recurring UTIs, and then urinary symptoms such as urgency, frequency, for example, or stress incontinence can get worse at this time. And you can use local vaginal estrogen that isn't absorbed systemically, and it can be really effective. And then there's things like weight gain, restless legs. I get restless legs. It's just the weirdest thing to try and explain, but it is very disturbing. Joint or muscle pain, increased allergies, digestive issues, brain fog, fatigue, poor memory, poor concentration. So you can imagine for women who are going back to work after a diagnosis and their treatment is finished, and if they're left with these types of menopausal symptoms, it can be really difficult. A lot of women report that they find it really hard going back to work. I have really noticed this. I'm on tamoxifen now, and the brain fog, I lose my words. It can be just so embarrassing. And I think, you just need to try and explain to people what's going on, because it just comes out of the blue and it's really hard to deal with sometimes. And then things like mood swings, anxiety, irritability, low mood. Some women will never have had anxiety in their life, and then all of a sudden they're really anxious. Obviously, it's difficult to unpick, is that because you've had a cancer diagnosis or because of the drugs that you're on, or is it menopause? So that's why it can be difficult. Oops, sorry, wrong way, wrong.
Hi,
sorry, going back. Okay, lack of motivation, tearfulness, loss of joy, and reduced confidence. And then here is Ellie.
Barnes. I am 24 years old and I went through menopause at 15 years old following my cancer treatment. So when I was 14 years old, I was diagnosed with stage 4 alveolar rhabdomyosarcoma, which is a type of soft tissue cancer. And because of that, I had to have 18 months of cancer treatment. So this included intensive chemotherapy for 9 months, followed by a year of maintenance chemotherapy. And then I also had some pelvic radiotherapy in between as well. So yeah, it was a crazy time. And then went into remission thinking, anything that life throws at me now, I can cope with, because I've just been through 18 months of hell. But how wrong was I? Because I completely underestimated menopause. As amazing as my pediatric oncologists were during my treatment, they themselves weren't used to dealing with menopause in young people or anyone for that matter. So I don't think they really knew how to counsel me on that, and maybe didn't recognize that potentially they should have actually referred me to a menopause specialist. I had a lot of fatigue, muscle and joint pain, vaginal dryness, had hot flushes, night sweats. I was getting up 2 or 3 times in the night to go for a wee. And all these symptoms I thought were due to my cancer treatment and would eventually get better with time, but actually they end up getting worse. So much so that when I was sitting my A levels, I was worried about whether I would be in a state that I could sit long enough to sit my A level exams, because the pain from down below due to that atrophy and dryness was so bad that it was too much to bear, thinking sitting for 2, 3 hours. And despite telling my oncologists about these symptoms, they themselves hadn't joined up the dots. Personally, I think there should be much better menopause support for cancer survivors, regardless of their age. So much is impacted when you go through menopause. So being able to have a specialist to help guide you and coach you through that really difficult time when you've already been through a very tricky time is like of utmost importance.
And that's just another story. She's amazing. She's at medical school now. So you've noticed that you've got some symptoms. What are your options to help them? So managing menopause and cancer doesn't require a this or that approach. Your action plan needs to be as individual as you are, often being multifaceted. And what can you do for yourself, and what can your medical team do for you? Because there's actually a lot that you can do for yourself. So these are some of the things that are in the Menopause and Cancer Toolkit, and some of the practical things that you can do. So there are lifestyle options, mindset, non-hormonal prescribable options, complementary therapies, hormonal options. Both systemic HRT and also local vaginal HRT. So going into more detail now. So if you can take HRT, then that's great. But even if you are taking HRT, you mustn't forget the diet, exercise, and avoiding triggers, things like avoiding coffee, spicy foods, etc., because they can make things like hot flushes worse. Exercise, if you don't do any exercise, now is the time to really think about getting your body moving, trying to find something that you enjoy doing, and also looking at, you know, how you can tweak your diet to optimize your long-term health. If you can't take HRT, then obviously that's even more important to be looking after your bones and your heart health. Doctors can prescribe drugs that are used for other reasons but have been found to help menopausal symptoms. So oxybutynin is used for overactive bladder but can help with hot flushes, as can SSRIs are antidepressants, but they're used for in lower doses, and there's also SNRIs as well, which are also low dose antidepressants. And then there's gabapentin and pregabalin. They're used for pain, anxiety, and can also help with hot flushes, etc. There are then the alternatives, such therapies such as acupuncture. Acupuncture really helps my hot flushes. There's CBT, which is cognitive behavioral therapy, and CBTI, which is for insomnia, yoga, mindfulness, meditation, talking therapies, and herbal medication. So there are lots of options out there. And herbal medication, you just need to be careful that if you are taking a herbal remedy, that it's not contraindicated with the treatment that you're on. For those that some women may be able in your community may be allowed to take HRT. For those women who can't take HRT, most women can take local vaginal estrogen or can use it. And then social connection is really important. Find your tribe, connect to others. Being less alone helps with managing symptoms. If you're interested, Danny has just published this book, which is an amazing resource for you as a patient and for healthcare professionals as well. It's really beautifully written, really easy to read, just talks about everything that we've been discussing today. It's really great. And then our support services, we have lots to offer. We've got online and in-person expert-led workshops. We're lucky to have access, excuse me, to a community of medical experts who can provide the community with guidance and advice on many topics. And we adopt a holistic approach. Nothing is off limits that we talk about. We run an award-winning 16-week menopause program. We had our first retreat this year and are planning another one next year. And this is probably the most cathartic experience because the community find real support from each other when we do these in-person events. Danny has an amazing weekly podcast with loads of different people on there, healthcare professionals, people from the community. It's fantastic. And that comes out every Wednesday. And I know it's called Menopause and Cancer, but anyone going through menopause could learn from her podcast. And we also run CPD courses for healthcare professionals. And we have, as I mentioned, we have the community get-togethers, just walk and talks in different areas around the UK run by volunteers. That's it. And then just here are some lovely images of our community and just some quotes. The knowledge, insight and sense of community I'm gaining is invaluable to me. You are the first organisation I've seen who's opened up this conversation and I've been searching. Thank you for not forgetting us. Service user feedback, 100% felt more informed about their medical and non-medical options and felt more empowered after talking to us. So if you are needing to, if you do feel like you would like to see a specialist, if you feel like you're not getting the care that you need, you can search for a specialist on the British Menopause Society website and you just put in what your location is. You can put in whether you want to see an NHS specialist or private, bearing in mind in the NHS, the waiting lists are long, as I've mentioned before. And also lots of specialists offer online consultations as well now, if it's not convenient to travel. So you can scan this to get to our podcast. Every conversation brings with it the opportunity for change. There is also, you can also get support from places like Macmillan and Maggie's. We sometimes do events at Maggie's centres and they offer various drop-in services and there's a support line. And there's also the organisation Working with Cancer, which is a wonderful organisation which provides coaching for people returning to work. You can scan the QR code to go to our Eventbrite page, and there you'll find all of our events, from walk and talks around the country to our monthly online Community Connect session, which I run, which is like a virtual coffee morning. And these are just some of the experts and people in our community, and this QR code will just take you. This is the website here. And that's all. Thank you very much for your time. If you've got any questions, I will stop sharing. There you go.
I haven't got any questions, but wow, that young lady was, wow. You don't think I'll be at that age, do you, sort of thing?
No.
So you're like, oh my word, it's
No, her
what a life.
story it's terrible. School student at the moment.
Yeah.
Yeah, no, she's amazing. So,
can I ask a question that you may or may not be able to answer?
sure.
I thought I was going through menopause for the last, like 3 years ago, but actually all the symptoms have turned out to be Waldenstrom's symptoms.
Yeah.
And so now I'm just finishing treatment.
Yeah.
Is there any way of knowing whether I've actually gone through menopause? Is there any,
Well, can I ask how old you are, please?
50.
Okay. So you're on the cusp. You will be around menopausal age. And as I was saying before, it is really difficult because a lot of symptoms overlap. So if you are coming to the end of your treatment, I suggest just keeping an eye on what your symptoms are. Keep an eye on what's happening with your periods. They may or may not return. At your age, post-treatment, they may not, because you're on the older side of sort of the menopause bracket. So the only way of knowing if you are menopausal is if you haven't had a period for 12 months.
I haven't had a period for 3 years. But so all the symptoms that I thought were going hand in hand.
Yeah. So it is difficult, Hannah. And I think, recommend blood tests to be measuring estrogen levels, although they may do in your situation. So it's probably just a matter of waiting and giving it some time. Yeah. And then, say if in 3 or 6 months' time you're still getting a lot of symptoms, it probably is going to be down to menopause.
Okay, and if all the symptoms have cleared up because of the chemotherapy, maybe I'm okay.
Then great, because sorry, it can sound a bit gloom and doom, but there is a percentage of women who get no symptoms at all and just sail through it. So it is very individual, and all I would say to all of you is just educate yourself about it and know what is the normal for you, or try and understand that. Read something like Danny's book, or there's lots of really good menopause books out there. But I mean, Danny's, I'm not just saying it, I don't get a commission, but it is a fantastic book that's just really easy to read and take on board. And I just think you can just really empower yourself. And you can go to your doctor as an informed person. And I think, that counts for a lot.
Thank you.
I think what Hannah has said, speaking to other people within the community, is really common. I mean, the hot flush thing, kind of like, with Waldenstrom's is really high as well.
Yeah.
So, I have a BRCA2 diagnosis as well as Waldenstrom's.
Oh, bless you.
Yeah, no, I definitely pull the cards. But So I had prophylactic surgery. I lost my mum and my grandma to ovarian cancer.
Right.
I had prophylactic surgery age 48, and then and did have, surgical menopause and kind of like straight into it. But I think also a lot of that was Waldenstrom's as well, which tends to kind of like trickle feed as well.
Yeah.
I think it's very difficult to kind of like tease these things out. And even, I mean, I'm 60 in a couple of weeks time, so it's like I'm 12 years since I had the prophylactic surgery. But it's like, even talking, hearing what you've got to say now, I think it's kind of like what your organization does is a wonderful thing, and just opening up that conversation. I wasn't given very much support at all, and it's been a bit of a voyage of discovery.
Yeah.
So
it's hard, isn't it, Nicola? It's really hard.
yeah, no, definitely. And I think it's good to talk about. And I think it's something, I mean, what occurs to me, and this isn't necessarily a question I think you'll be able to answer. So I had bendamustine rituximab 2 years ago now, recovered well. And I'm still taking Adcal, which in my head I'm thinking, okay, this is probably quite good for my BRCA2. Really, it's got nothing to do with my Waldenstrom's. But I had a DEXA scan yesterday just to try and kind of like, get on top of that bone density thing. And it's, I am aware that like using alkylating agents, chemotherapy, that has an impact on bone density as well. And it's really something for WMUK maybe to look at with regards to, our population, women who are having chemotherapy. Should we be on other medication as well in order to support ourselves, or should we not? I don't know the answer to that question. I don't think you do either. But, it is something that's very much on my mind.
But I think if you have a look at all of the things like the acupuncture, etc., if you're getting hot flushes, I can't see any reason why you wouldn't be able to do that, for example. But I hold my hands up. I don't really know enough about your type of cancer, so I can't talk specifically about that. But I'm sure that there's a long list of things that you can use. Unfortunately for you, Nicola, HRT is, out of bounds, really. But vaginal estrogen, you can probably still use. But I think there are a lot of things there. If you are getting, those sorts of symptoms, asking your doctor, look, would, having a list of things, I've heard about this, would I be able to take this for my hot flushes, for example? I think
I've had those conversations in the past. I mean, I don't want to make this all about me at all, but it's kind of like, I find it's like they're super conservative. It's kind of like the doctor would rather you don't take anything.
Yeah.
Having spoken to the gynecologist at the hospital, they're again extremely cautious. And it's just sort of like, finding that person who has the real understanding and being able to have that open conversation.
Yeah.
Really difficult.
And, probably for somebody like you with quite a complex history, going and seeing a menopause specialist. But again, it's the access, and it can be quite difficult. Menopause and Cancer, we've got about 5 specialists who will see patients from our community that we pay for. But again, there's now a waiting list because there's so many women who really feel that they need some specialist care. And you are eligible to have to be referred to a menopause specialist on the NHS if you have had a cancer diagnosis. So, it is worth speaking to your GP or your team about that as well.
Okay.
But it is such a difficult situation because, as you're saying, you're getting symptoms related to 1 or 2 of your cancers. How do you unpick what it is? I appreciate it's really difficult.
Okay, fine, thanks.
Okay.
Has anybody else got any other questions? No. Like I say, I think it is that bit. I mean, obviously, I'm still very new to WMUK, but when you were listing the symptoms, I was like, okay, that's one of ours. Yeah, that's one of that. And you're kind of thinking, oh my word. So, like you say, like Hannah and Nicola both said, it's trying to separate it out and see which is, the menopause and which is thingy. But I think having this talk tonight at least has, highlighted some of the topics, and has been a really good conversation. So thank you so much for taking the time to do that for us.
You're very welcome. And I just think there is lots that we can do for ourselves as well. Like looking at our diet and our lifestyle. And I think a lot of the time when women go through menopause after a cancer diagnosis, they just feel like, I have no options. But I hope what you can take away from this tonight is that you do have options. And I think it's a positive thing to take away, hopefully.
Yeah, definitely. Thank you so much.
All right. Thank you, everyone.
It's also really nice to see other women, younger women with WM on a call, because every time I've been to the chat, well, I've only managed once, but there were very elderly people, and this is really nice to see.
I was quite surprised when we had 12 people registered onto it. So I was like, oh, it'll be good, like you say, to see, the ladies there sort of thing. So yeah, thank you for joining us. And like I say, if we can get another conversation going, like we'll do a coffee and chat just so we can just get the ladies on and just, have chats like this, then we can organise that. That's no problem. But yeah, once again, thank you, Anna, for taking your time out to speak to us.
You're very welcome, Carly. No problem.
Yeah. Then we'll be in touch soon, I'm sure, with lots more questions.
Okay.
Okay, thank you so much, ladies, and enjoy the rest of your evening.
Thank you. Bye-bye.
Take care. Bye-bye.
Bye-bye.
Bye.